Hello and welcome back to the Information Command Center, St. Lucia response to COVID-19. Where is another live update? I am Lucia Jules. With me for this afternoon's update is the Director General of the OECS. It's Dr. Didicus Jules, who will be examining how the OECS countries have been responding to COVID-19, what are the projections for recovery, and how the Commission fits into all of this on the ground. We want to say hello to Dr. Jules. Thank you so much for joining us. You know, here it's a fast pace. We're constantly moving with the information, and we're very happy to have the inclusion and participation of the OECS Commission.
Thank you very much for having me, Lisa.
Just to also remind you, as always, we'll be taking questions on the Facebook platform. So as we go along, the questions that you may have, please post them, rather post them so that I can post them to Dr. Didicus Jules. Dr. Jules, we've seen that COVID-19 for the Caribbean and the OECS included in that. We've seen containment, and the OECS islands have, by large measure, been able to have some form of control over this pandemic. It doesn't mean that we're out of the woods, but it means then that the OECS countries working in tandem, looking at particular systems and implementing certain protocols, measures, we've been able to fare very well. Would that be your assessment?
Yes, it is. As has been often said, this is a time of great uncertainty. And this is all the reason why we need to monitor what is happening very carefully. But from all of the monitoring that we've done, the OECS has done exceptionally well in comparison with the rest of the Caribbean, and certainly in comparison to the rest of the world. I have brought some slides with me that I hope that your people can show that will indicate empirically what the situation is. So for example, as of yesterday, midday, the 4th of June, we see very low levels of infection in the OECS compared to other countries, with the exception of the French members of the OECS. And there is an explanation for that, because, for example, Anguilla had up to yesterday, 3 cases, Antigua and Barbuda 25, the British Virgin Islands 8, Dominica 16, Grenada 23. Well, I had St. Lucia at 18, but today it was announced as 19. You have St. Vincent and the Grenadines at 26. Martinique, in contrast, stands at 200, and Guadeloupe at 162. And that compares with other Caribbean islands like Barbados at 92, Bahamas at 102. Well, Belize is trending more like the OECS at 18. We have Bermuda at 141. We have Jamaica at 590. Jamaica is the highest in the Caribbean. We have Haiti at 507, Trinidad and Tobago at 117. So the figures speak for themselves, and I think that is a consequence of the very early decisions taken. From the time it became clear that this pandemic was beginning to spread in the first month, in fact, the first week that of the alerts going out internationally, the OECS heads of government started meeting weekly to discuss what was happening and to converge the efforts. Now, I know there's been a lot in the media about people wanting to compare what this country is doing versus the next. And that's one of the reasons I'm here today, is to give the assurance that, in fact, each country has its nuances, but generally the OECS heads have worked very closely together as a grouping, and we have developed an overall strategy for dealing with this. Each country, however, will implement that strategy according to the peculiarities of their condition.
But it's that mindset that perhaps if we hear and see that Dominica is doing something that St. Lucia isn't doing, that idea that perhaps St. Lucia is left behind, or there may be some incompetencies within the, whether it be the health sector, within the government. And so how does the Commission, perhaps if it has a role to play in that, how does the Commission now allow the public to understand very the very thing that you've said, that there is this harmonized working position taking place, but it doesn't necessarily mean that things would happen simultaneously with each of the territories or even in the same likeness as in the other territories.
Well, first of all, we need to recognize that this is a very dynamic situation. So nothing is perfect in that environment, and our public services generally in the Caribbean are not the most efficient public services. Now, that's no aspersion on them. It's simply that the reality is that certain things may fall through the cracks, but the record speaks for itself. As a region and as individual member states, we've done exceedingly well. The exceptions to that case, Martinique and Guadeloupe, there's an explanation for that. Because they are French territories, they remain open to Europe until the French state closed its borders. So it meant while we were shut down and while we were not intercoursing with Martinique and Guadeloupe, people from Spain, from France, from everywhere were free to move in and out of Martinique and Guadeloupe. So that accounts for, in large measure, what has happened.
But how do we now look at the situation with St. Vincent and the Grenadines? Their borders remained open despite the decisions by the other OECS territories to close borders.
Well, as we said, again, we had worked out the principles of the strategy and the triggers that should be utilized. So again, remember, we're dealing with sovereign states. The OECS Commission is not in a position to dictate anything. And in fact, the strategy is not something we sat in Castries and designed. It came out of the meeting of the heads of government, a lot of intense discussion and debate and proposals. In fact, what we call the HEESS strategy, HEESS, standing for Health, Economic, Education, Social and Security. That acronym was actually proposed, that concept was proposed by Prime Minister Gonzalez in one of our early heads meetings, because we wanted to be sure that we take a holistic approach to that question. It's not just a matter of dealing with the health emergency, because it was very clear to us, based on the lessons that we learned from the international, what was happening internationally. The Chinese, for example, came up with the idea of 4 E's: early containment, early testing, a whole range of things. We applied those lessons to the OECS. So, we have a framework that we know is holistic, because it looks not just at the medical impact, but the economic, the social, the educational. And when we were discussing, for example, at the level of the heads, the question of opening up of the economies, a couple of the heads pointed out that, we can't divorce the opening of the economies from the opening of schools, the reopening of the education sector, because there's an organic relationship. Just the simple fact that so many parents, as part of their routine, take their kids to school. So if parents are returning to work, what happens then to the kids in terms of supervision, continuity of learning? So all of the strategy used in the OECS has been designed around that. And one of the really encouraging things, while people are looking at COVID as a great catastrophe and a pestilence that has been brought upon us, I think it may be a pestilence of biblical proportions, but it is also an opportunity of unprecedented proportions. We are looking at look at how long we've been talking about digital learning. Yes. And in just a matter of, in a matter of weeks, we've had no choice but to go there. Now, the really encouraging thing is that from the OECS perspective, we have a number of working groups comprising the best expertise. So there are 4 working groups in education. Let me just pull this up. 4 working groups in education that looks at a range of things that are meant to harmonizing of policy, learning continuity, content development. And these working groups comprise the best expertise in the ministries of the member states. And they've been working together to converge effort and to come up with frameworks within that. So the continuity of learning initiative is going to be really exciting when it is launched, because the type of work they are doing. Later this week, for example, we are going to be launching something called Yes I News. Now, YES stands for the Youth Engaged Society, which is OECS's brand for its work with youth. And you know the whole resonance of YesI, right? So young people reading the news. What has been happening in terms of learning from home is that teachers have been reading stories to their kids remotely using WhatsApp or YouTube or whatever. And now we move into a completely different level with that. The kids are reading stories to their peers. So what is happening, rather than them listening to the teacher, they are now reading to their peers, right? And we're moving a step further with them writing their own stories and reading to peers. With the YesI News, the kids are going to be the anchors. Primary school children will be designing their own news, interviewing their peers, interviewing persons in different spheres of society about what's happening with COVID. But really it is about creating a news package that is run by kids. It's very much inspired by the Kiddie Crew thing that June King Frederick. In fact, I've had discussions with June Frederick about ways in which we can revive that concept of Kiddie Crew as an OECS initiative. So the idea is that we will have these kids doing their own news package that speaks to their demographic.
And that reminds me of when I started off in media with Youth Talk, with the late Jakes Compton overseeing that. So, because I can see the value in something like that and how often we speak about critical thinking in our young persons and how that can
it's reading,
really
it's
push them into that
it's
critical
writing,
thinking.
It's a different approach altogether. And I think all of that, you know, people have often asked me, what are the most fundamental changes we need to make in education? In a sentence, it's simple. Make learning fun. And all of that will make learning fun. Part of the work being done by...
But how does that now? Because the idea of making learning fun, some people may conjure the idea, then how does that fit into exams? Because if you're making learning fun, is it simply using the methods that the children themselves will be gravitate towards? And really are those who are designing the examinations, are they really in tune with how the students have already been learning?
Lisa, you're raising some really, we'll need a whole program to discuss that because that's a favorite beef of mine. Even when I was at CXC, I often said to people, learning is not a competition. And I think one of the problems in the region is that we are over-testing our children. And in this period of COVID, one of the big dangers, which is why we're doing this work as an OECS collective with expertise from ministries, a lot of people have launched learning platforms and so on. If you examine some of these platforms, all they do is test. They are test practice sites. And that, I think, is very dangerous because the time you spend on practice tests is time you should be spending on learning. If you learn properly, you will pass the test, right? So there's this phobia about over-testing and competition to see who comes first, who comes second. This is not what learning is about. And it is injurious to our objectives in education to be promoting those things.
So back to the overall education plan that you have devised. So it takes into account a lot of what you've just said with regard to the fun learning.
This is an opportunity to radically transform the pedagogy of learning, not just move the old methods to an online platform, but to reinvent the methodology so that students take more responsibility for their own learning. Secondly, that we make learning more of a journey of discovery. So there are handbooks being prepared for parents right now that will enable you to continue assist the learning process at home by using things happening at home. If I'm in the kitchen and I'm cooking, you know, there's mathematics in that, there's home economics in that. Part of the discussion we had, with one of the learning continuity group is the opportunity for crossing the subject boundaries, right? Because we've treated subjects in silos, so here's an opportunity now to be transdisciplinary in our approach to learning. So there are so many, and it also revolutionizes potentially the relationship between parents and teachers. I think for probably the first time in many generations, we are beginning to see teachers in a different light.
A whole different light.
A whole different light, because especially in recent times, I'm talking in terms of my generation, because life has been so fast-paced, people are living professional lives, essentially parents have reached a point where they dump their kids in the school, and raising your kids is left to the teachers.
And then you pay for extra lessons.
And you pay for extra lessons, so everything is off your back. Yes. And now suddenly they have to actually handle their kids for themselves, take responsibility for some of the learning of their children, and then they understand what teachers have to go through.
And so
we need to seize these opportunities, I'm saying in essence, that COVID is presenting us to.
How
really
are we doing with that now? Because we are still in that, within the scope of the pandemic.
Yeah.
So how are the islands faring, especially with the e-learning? How quickly, I know that you said within weeks, for example, St. Lucia, we know within the St. Lucia context, we know what happened, but give us a sense of the other islands. Have they been able to roll out the programs online efficiently?
Yeah, all of the islands have rolled out. They follow the same basic protocols. I've seen pictures. For example, I've seen some of the pictures of schools in St. Lucia with the physical distancing of students, the protocols for entry in the school, even the use of the digital thermometers in some cases for them to come. One of the ideas that we have looked at is the idea of, because kids are so kinetic, always running and touching and so on, how you maintain the social distancing. Aside from masks, we've raised the idea with education officials, not just masks, because some of the small kids will remove the mask, especially at the kindergarten level, the use of face shields, so that it kind of protects the air around them from transmission or receipt of inhalation of anything coming close to them. So we're looking in very great detail at some of those things, and the protocols that we've developed are based on that type of analysis.
How much work is the OECS Commission still doing? I know that it was heavily involved, discussions on the whole, we're looking at with the telecommunication companies. So we know that with the e-learning, of course, we need to be able to have that internet penetration, and we know that it's not equal in all of the states.
Yeah.
So
well, that is one area that we've not. Our engagement with the telecom providers has been not as close as the member states' engagement. What has happened, more or less, to be frank, is that the member states have made their own arrangements with providers in their geographic space. We are, from our end at the Commission, we are looking at a more strategic angle to it, because we recognize that a lot of the arrangements that are put in place have been put in place in a crisis context. Now, governments are really, really swamped with this crisis, and I think people need to understand the challenges that are being faced by our governments in terms of how to manage every aspect of this thing, balance the economic with the health imperatives, and also look at the financial consequences and so on. So we at the Commission have a bit of the luxury to step back from that and look at the transformational opportunities and the longer term possibilities. So for example, I spoke about the face masks and all of that, and you mentioned the digital divide with students using computers at home and so on. We've done the homework on that. For us to move to have a full capability for online learning and ensure that no child falls through the cracks, we are going to need 170,000 devices at the homes of kids to enable this to happen. Now we fall far short of that. So again, using the procurement platform of the OECS, because as you know, with the PPS we procure drugs and so on, we're now moving that to a full procurement platform, and CARICOM has asked us to be part of the SEDIMA procurement cell. So we're not just procuring for the OECS, but we also, at least certain critical requirements for COVID, we're doing the procurement for that. So we're moving our operations to a whole different level. And we're not just procuring medical supplies, but we'll be looking at devices, we're looking at other stuff that is required. Now on the telecoms front, we have one of 3 regions of the world working with UNICEF on something called the GIGA initiative. And the GIGA initiative is about GIS mapping of schools in every country. We've completed that GIS mapping using the satellite imagery and so on. We're able to actually pinpoint schools on a geographic information map. We have also mapped to that what is the degree of the extent of bandwidth available in each of these schools for all of the OECS. Now with that knowledge, we then look at what are the gaps and the deficiencies. And UNICEF is working with us to aggregate the demand required for optimal use of digital learning so that we can then do a procurement. So it's not a matter of working on an arrangement with Flow or Digicel to say, you know, give us a couple hours free or so. No. And we've had discussions with ECTEL. There is the opportunity for us to go into a new round of liberalization because effectively, if you recall, in the days of liberalization from the cable and wireless monopoly to Digicel coming in, there was a whole explosion of, that's why every solution have two cell phones, right? There's been an explosion of that. But now we've come back to a situation of a duopoly because the two of them are sort of controlling the market. We now need to further liberalize that market, allow new entrants in who can be more competitive so that we can get broadband really at this point needs to be, like they've declared it in Europe, to be a human right and a basic public good.
Yeah. We have a question coming in from Deidre. Thank you so much for your question. She wants to know what sort of conversation was had with the heads of government pertaining to parents returning to work and their children who are at home, who are remaining at home. I know we briefly alluded to that.
Yeah.
So,
well, the conclusion of the heads on that was that the two had to be related. So we could not talk about the reopening of the economy and people returning to work without also looking at what does that mean for schools. And so just as you have a phased reopening of the economy, to have a phased reopening of schools. And that is why you see across the OECS, this is generally happening. That, for example, not all children have returned to school, neither have all persons returned to work. But you have those who are most directly, whose career are most likely to be interrupted by COVID. So the common entrance students and the CXC students returning to their classrooms.
Let's look at what's happening to us with respect to the economics of COVID across the islands. We know, yes, that the tourism sector, we're heavily reliant on tourism, but give us an understanding of where the countries are really at in terms of being able to bolster themselves through this very torrid period. And we can't even say post-COVID, that's not a likely term anytime soon. So at this very moment, are we seeing that our governments are able to stay afloat?
No, the blows have been very hard to all member states from COVID, the shutdown of the economies, and a lot of it is almost directly related to the shape of your economy. So Antigua, the Antiguan government has indicated that tourism in Antigua is about 80% or more of their economy. So a shutdown of tourism literally means a total and absolute shutdown of their economy. And that was why, if you notice, the countries that have been most tourism dependent are the ones who have been thinking more aggressively about how do we start to, in some form or fashion, reopen the economy because of the number of persons who are out of work. And the impact of that on government revenue, on people's livelihoods, what is that going to do to poverty indices across the region and so on. So it's been very hard, but the OECS heads as a grouping are actually operating on at least 3 fronts. One is as a grouping, they have approached, there's a lot of what I call economic diplomacy, reaching out to the multilaterals, World Bank, the G20, the G7, indicating to them that there are a number of things that need to be done. We've raised the issue of supplementary support, budgetary support to governments. First of all, the whole effort started domestically. So the East Caribbean Central Bank, from the very earliest stages, put measures in place for an easing of provision of funds to governments to address the immediate requirements for containment of COVID. So ECCB gave each country several $1 million, some of which is allocated through the OECS for procurement of the necessary essentials, but some of which is used by governments at their discretion in areas where they most need to inject that cash. So at the regional level, charity began at home. But then there's also the outreach to the World Bank, to the IMF, to all of the multilaterals, indicating that there are several things that need to be done. One, in terms of emergency response by way of cash injections, grant support, etc. And then some more strategic issues that needed to be tackled, which COVID has brought to a greater prominence. So for example, how can you talk about countries that are ineligible for certain types of foreign assistance, like Antigua and St. Kitts, for example,
based on GDP.
Based on their GDP or their per capita income, when in fact the GDP overnight has disappeared and the per capita income is down to nothing. So that kind of that kind of advocacy has been going on in a more strident way, with the heads speaking as a grouping. We've had bilateral meetings, for example, virtual meetings with, for example, the foreign minister of Spain. We had bilateral meetings with the foreign minister of Argentina. And all of them are being encouraged to support that effort. And by the way, the interesting thing is that our governments are not just talking for themselves as OECS, because they frame all of this type of diplomacy,
within the CARICOM context.
Not even just the CARICOM context, in the context of SIDS, small island developing states, because we all affected in that way. So there have also been discussions with some of the Pacific and the other small island states that have been affected, so that when it comes to, and discussions with the UN Secretary General. Now, of course, in making the case to someone like the UN Secretary General, the thrust is, okay, while the Caribbean, we advocating on behalf of our region, because that's where we're from, but we are small island developing states. So the case we're making is really for heightened advocacy by the UN of small developing states who are affected in that manner.
A lot of people have wondered, debt forgiveness, is that something?
That's part of the thrust as well. So it's debt forgiveness, it's removal of these senseless formulae and the replacement instead with what we call a vulnerability index, which looks at climatic, financial, economic, structural vulnerabilities, even certain disadvantages of size, so that you can then come up with a more realistic way of assessing the condition of small states.
Right. We're speaking here in the Information Command Center of Dr. Didicus Jules. He's the Director General of the OECS. Stay with us. We'll be back after this break to continue the conversation.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
Welcome back to the Information Command Center, and we're having the conversation with Dr. Didicus Jules. He is the Director General of the OECS. We want to look at health across the OECS. COVID-19, a lot of people use the phrase, it has exposed so much of what is perhaps the inefficiencies within the health sectors. But of course, the capacity of the OECS health systems, we have that worry, the constant worry that if we were to see a sort of second wave of COVID, that we just will not be able to survive that. For the OECS countries, what has perhaps been the biggest challenge in being able to have to sort of enhance the health systems to respond to COVID-19?
It's the legacy of what we have in health. Let me just sort of, before going to the meat of your question, just backtrack a bit, because you recall when the Ebola crisis hit.
Yes.
The OECS ministers of health were meeting weekly using video conferencing facilities. We had something like 83 meetings over the period of that Ebola crisis, and a number of decisions were made. One, we were already looking at how we can be in compliance with the international health regulations. And at the time, even prior to Ebola, we had started that journey. But then the cost of compliance was so high that we were doing the best we could with the resources available, but felt, okay, some of these things really looked like too onerous to implement. Now, hindsight is 20/20 vision. Looking back then, had we really bitten the bullet, which would have required a huge investment by governments, we would have been able to be in a different place altogether with the advent of COVID. But even some of the work we did then has helped us when COVID came. We never anticipated COVID. We never knew it would probably happen. But it has made a difference because, for example, we had started doing procurement of PPEs for the COVID. So we had the contacts, we had that supply chain already tied up. We had sent 50 persons from all across the OECS to Pedro Curain in Havana for training, the Institute of Infectious Disease Control. We had a Cuban SWAT team available to us that within 8 hours could be in any part of the OECS where there was an outbreak, because our estimation was no matter how well trained our people were, if there was an outbreak, people may freak out, and so we need persons with experience to come get a handle on this to help us. And so all of that infrastructure of collaboration remained in place. And that's what made it very easy for the governments at a bilateral level to activate Cuban assistance to come in so quickly. One of the areas that from the OECS end we had to really push hard for were the British overseas territories, because they were trying to get assistance and we had to go through a whole diplomatic thing to get that sorted out. But yeah, so the challenge had to do with the condition of our health infrastructure as a whole. Notwithstanding, thankfully we had some measure of preparation that we were able to extend into the arrangements for the crisis.
Now, COVID has placed demands on, especially when it comes to equipment. We know respirators, that is gold, in having to respond to COVID-19. How are the islands doing with the stock when it comes to respirators?
They're doing reasonably well. We have mobilized something like $1.9 million US from the corporate private sector. Places like Massey and Republic Bank and Sagicor have been of immense help to us in mobilizing the finances required to help purchase the respirators. As you know, that has been a real challenge in terms of the supply chain internationally. We've had some countries' orders of respirators seized or held back in the US.
Because they're looking at themselves
because persons
first.
are looking to protect themselves first. So the demand far exceeds supply, and that has been a huge challenge for us with some of the orders that we've made. But things are beginning to ease up now, and we are able to see more speed and responsiveness in what we order in. We've been able to get, the biggest thing though is not respirators in terms of the challenge for us, it's test kits.
Yes, we was getting to that, the testing capacity.
Yeah, the secret to the management of COVID, as you can see if you listen to the CMO's deliveries across the islands, particularly in St. Lucia, and kudos to Dr. Belma for the work she's done, if the biggest challenge is testing, the more we can test and the more accurately we can test, the better handle we have on what is the trajectory of the disease across the population.
What is our access to getting those test
Well,
kits?
that's one of the areas that we've devoted an enormous amount of time and attention to. I don't know if you saw on the BBC recently, there was a story about Senegal developing some test kits for $1 US, which they claim was very accurate. Well, the day after that report, we had all of our missions in Geneva, in the ambassadors in New York and Washington, trying to make contact with embassies of Senegal so that we can get access to those kits. We finally made contact through the European missions, and we're in touch with them. The test kits are being manufactured in Senegal for use in Africa only. But they have an arrangement with a company in Switzerland that is developing, producing the test kits for sale principally to developing countries. Now, I don't think they're going to be at $1 US for that.
Once they've gone through that channel.
That channel, yeah, but at least it's going to be much cheaper because the regular reliable test costs anywhere from 100 to 300 EC dollars per test. Now, in a context of the need for rapid and widespread testing, this becomes an unassumable cost for our governments, right? And so we are aggressively trying to get donations of test kits and all of that. The other thing too is the testing equipment. We discovered through our mission in Brussels that the International Atomic Energy Agency is providing the most accurate testing equipment available globally, and that uses radioisotopes and so on. It's very sophisticated. It identifies every type of virus that is known, and it does it within very quick time. Within an hour, multiple tests can be executed at the same time. So we approached them, and we got agreement from them to provide one of those pieces of equipment to each member state, including St. Kitts and Nevis, which was not a member of the IAEA, but we were able to make the case because of the unification and the free movement of people in the OECS that leaving them out would leave a hole in the testing network. So we were able to get it. Ironically, St. Kitts has received the equipment, Antigua has received it, the others are on shipment to St. Lucia, Grenada, Dominica, etc. But our thrust there is really to just get as much of the equipment, do the procurement as speedily as we can. We just signed up with on a platform called Easy Buy that is recognized by the World Bank. And yesterday we had a meeting with all the top procurement people and finance people from the region. That platform is going to put us in at a different level altogether globally, because it subscribes to the global open procurement standards, which is the highest standard of integrity for procurement that exists. So it means, therefore, that persons wanting to supply, if we need, let's say we need 250,000 face masks, we can put that up on the platform. The persons who come into the platform to bid have to be pre-approved. So there will be the diligence checks on them to know that they're not fraudsters. They do have what they say they can do. They can deliver on time. And so they're allowed to bid. Now, because many providers are bidding, you can then do almost like a reverse auction to get the best possible price. But more importantly, that platform is also tied to a logistics hub, which we've, through the work being done in Antigua, there's a warehouse of 20,000 square feet. I think it's square feet, but 20,000 in area that will allow for the receipt of any stuff ordered through that hub, and to break bulk with the guarantee that we can get supplies to any OECS territory by sea within 4 hours, within 8 hours, sorry, and by plane within 4 hours. So it is more than just a portal where you can order. It's tied to the logistics and the supply as well.
And you describing the processes, and it goes to show that for the ordinary man on the street, they just want to know that they can go in and access services, and that those services and the food will be there.
Like Buju
but
says,
it is more involved
it's not
than
an
that.
easy road.
It's
It's not an easy road, and it's very easy for armchair theorists to sit and talk about all what should be done, but getting it done in the context where the entire world is affected is another story. But there are many lessons, and that's why I keep saying there are strategic and transformative opportunities in this for us. We have relied on, with globalization, the whole supply chain of food, medicine, supplies have been globalized. Now people are looking at more localization and regionalization of their supply chains. Now, how does that fit with us? It's a great opportunity to put in place the free movement of goods that we've been talking about as an objective of the revised Treaty of Bastille. So right now we have before the cabinets of the OECS some new bills that we've prepared that would actually put in place a total change in the rules and regulations for the movement of goods in the OECS. Now we put that in with a very relaxed sunset clause, because we leave in the latitude for us to improve on that and leave that in place post-COVID to promote the free movement of goods across the OECS.
Now, I know within the health strategy, certainly food must be in there somewhere. We talk about nutritious foods, the food security for us, and we saw that how COVID has shown again that whole idea of persons beginning to take care of themselves, so that you will not be able to get those producers of certain food items deciding to only produce for their homes. When I say homes, in country. And so for us here in the sub-region, where we are so heavily reliant on importing most of our food, it certainly shows us that now more than ever, we need to be able to return to what we grow and eat what we grow.
Yeah, grow what you eat what you grow. In fact, there are many things happening on that front. First of all, we are doing all of this in close alliance with a number of key partners in agriculture, as well as with the Caribbean Health Coalition. And there are three dimensions to it. One is increasing commercial production of food for trade across the OECS and for export opportunity to wider markets. So a lot of tropical fruits, tropical foods, high nutritious value foods is the focus in this, and we're looking to do that exportation. Again, we'll be using that same platform I spoke about. We're actually going to be using it as a virtual agriculture marketplace, and in the coming week we're going to be doing a pilot with 3 farmers from St. Lucia, 3 from St. Kitts, 3 from St. Lucia, 3 St. Vincent, and 3 from Dominica, to test that platform properly, because again, people will be able to, they can show what products they have,
and then
people you place your orders, but initially it will be for large farmers or aggregators, so that the quantities can make sense, right? And as we go along, we will make it possible. But because of the logistics tied into that as well, it means the transportation is built in. So the shipping of the stuff is going to be very easy, we expect.
Do we really expect it to be easy? Because again, with COVID, we've seen the sort of shortages when it comes to the transportation, sea transport.
Yeah, but here's the thing. You see, we've been affected to a large extent by reliance on the global supply chains and the global transport networks. But we have shippers within the region, small shippers. For them now, this is a new opportunity to work together.
Because we're now looking at their way now.
Yeah, through that platform, in fact, our priority has been to bring these local shippers together in alliance with that platform to help with the supply chain. And that's why I said we're using Antigua as the hub, certainly for air cargo, but also for shipping cargo that can then be broken, but we can break bulk and distribute across the island chain, but the reliance will be on local shippers. Okay. And I think, you see, it's important in shaping these solutions for us to not just think big picture, as in foreign investors or outside commercial interests, but how do we ensure that the nationals of the OECS get new economic opportunity through the arrangements that we have to put in place.
And so the governments themselves must demonstrate that willingness to create the financial pathways to allow the nationals to be able to take advantage.
Well, all of that has been discussed at the level of the authority, the heads of the OECS, and certain measures are being put in place in respect to that. So as I mentioned earlier, we have this suite of bills in place that will change the arrangements for facilitating that shipping to happen.
Okay, very well. So take us through to some of the other aspects of HEAS.
Okay, and I want to focus a little bit on the health thing because that's, the pressing agenda, and to share with you the objectives that the heads agreed to from our very first meeting. First objective was to be able to appropriately assess infections and immunity, flatten the curve, so you slow or delay the introduction of the virus as much as possible within local populations, protect the most vulnerable, especially older persons or persons with chronic diseases, and then rapidly build up or augment the capacity of health systems. So we saw in all the islands, governments, again, according to local conditions, either recommissioning old hospitals, fixing centers in Barbados. Although Barbados is not part of the OECS, they actually built a COVID hospital in record time. And then the sharing of resources is important in that context. And there are many stories that have not been told of how collaborative our governments have been. So for example, about a month ago, the main emergency hospital in Martinique ran short of a very critical drug, and had that drug not been supplied, many of the patients in intensive care would have died. So they made an immediate call to us. We were able to contact our governments. Does anybody have that in supply sufficient to share with Martinique? We were able to get supplies from Dominica and St. Lucia. Medivac helicopters, French Medivac helicopters came in, took the supplies. Within hours, the hospital was supplied. As Martinique got its supplies in, they replenished the country's ruling. Dominica got a set of ventilators, I think, from the Chinese. They were able to share with Montserrat because, again, Montserrat at that time was peak. We were worried about the curve in Montserrat because of the spread of infection there. So they were able to get a ventilator from Dominica. So these are just examples of the ways in which we have been able to encourage, support, assist each other to make a difference.
And so it's very much so that all of us stronger together.
We're stronger together than separately.
Yes.
Yeah.
So good. Take us through to some of the other aspects on the HIS.
So on the health front, we spoke about a lot of it, as I said, our focus has been on the procurement of essential things like the test kits and so on, and we continue to press on that. Just by way of information, that procurement effort goes back 34 years, right? Because we've had the pharmaceutical procurement service. Yes. So now we're bringing this up to a whole level, but we did a calculation. In those 34 years, the PPS has had an annual purchase of approximately $10.2 million of medicines and medical supplies to the member states. So it means in 34 years, we have provided $1 billion worth of medicines at 30% on average cheaper costs because of the joint procurement. So that's a huge lesson to take forward into the future. We've also been leveraging partnerships. So the private sector, as I mentioned, Direct Relief International, our international relations, all of our diplomatic relations in order to get stuff sent in. We have had the donations, to give you an idea of some of the donations, Direct Relief give us donations of PPE valued at $9,000 US. They also provided us with hurricane preparedness packs. Now, they've been doing that since Maria. So prior to the hurricane season, in every country, there's a whole supply of hurricane packs that contain essential supplies in the event of hurricanes, but configured to the peculiarities of the state. So for example, in all of the countries we have a high prevalence of diabetes, hypertension and so on. These hurricane packs have drug supplies to address those conditions. So in the case of a hurricane wipeout, persons who are vulnerable will not suffer from have the medication. Yes, right. Yes. Sagicor has given us a whole lot of support. We got 20,000 US initially to buy 180 infrared thermometers. Direct Relief has also provided us with 50,000 US for gene expert test machines. Sagicor has given us another $50,000 to fight for COVID test cartridges. The Global Fund has given us 40,000 US. They've given us another 40,000 for swab medias. Massey has given us 160,000 US to buy 13 ventilators. Bank of St. Lucia has pitched in with 40,000. Digicel 100,000 for personal protective equipment. Republic Bank has given us 120,000 US that we're going to be using for some of the drugs that the Cubans have used successfully in China with the treatment of the disease, and as I mentioned, the International Atomic Agency. On the economic front, we've been guided by what we call the 4 E's: early detection, early reporting, early isolation, and early treatment. But this is what necessitated the rapid shutdown. So you had the restriction first on cruises, then the tourism contraction, then the airlines grounded, and then the whole tourism economy suspended. What that has, a consequence of that has been a very deep economic impact in terms of business contraction, government revenue decline, and now we head into a recession. So we have done a document that I urge viewers to go on our website, oecs.int, to download. It's called The Economy in the Time of COVID-19. So this is a comprehensive document looking at the economic impact of COVID and some of the prescriptions that are being proposed, not just by us in the Secretariat, but in collaboration with the Central Bank, as well as with expertise from the member states in how do we get ourselves out of this rut. So alongside the economic impact assessment is the Agriculture Food Initiative and support to the tourism sector. Now, because a lot of the big hotel chains have their own processes and means of getting their act together, like Sandals, for example, our focus on the OECS is largely in terms of policy articulation with the Ministers of Tourism in collaboration with the Ministers of Health, but also looking at the associated sectors of tourism, the ancillary sectors, the small traders, the persons who derive their income indirectly or peripherally from the tourism sector. How do we help them to get back on track? The other element of that has been in terms of stimulus packages. We have, at the level of the OECS authority, people have agreed on common measures. So again, while people may compare what is Grenada's stimulus package versus Dominica's versus St. Lucia's or St. Kitts, the principle of the stimulus package has been agreed on by the heads. So the issue of protecting the vulnerable, looking at how you can protect certain economic sectors and so on, all of that is built in. So the principles have to do with measures to support food production, import substitution, nutritious food and healthy lifestyles. The other big pillar is social and financial support for the vulnerable, the affected and the unemployed, which has mushroomed, and some variant of price control or price monitoring or price subsidy for essential items. And we also have measures related to debt relief, to fiscal easements for government or the private sector, some variant of concession or stimulus for families or strategic private sector producers, including fisherfolk, and some variant of unemployment relief. So again, because the OECS is using this opportunity, and we have been on a pathway to increasing convergence of the economies of the OECS, it is important that that framework be maintained. And as I said, according to the capacity of member states, they will determine the details. Yeah, it's tailored to suit.
Was there conversation on how the government will be able to access, especially for the stimulus programs? Because to the ordinary man, when he hears the idea of a stimulus, he believes that money is being handed directly to individuals or directly to businesses.
Yeah.
So in terms of the government being able to find the monies to do that, and of course, we do not know for how long those stimulus packages would have to be.
Well, that's where our joint, what I call the economic diplomacy comes in, because the conversations with people like the World Bank, the IMF, who are in a position to make the decisions that would create a easier economic support for governments to facilitate those things happening, is where that's where the discussion is taking place. So that to the extent that the IMF or the World Bank are able to provide support for, say, under a poverty reduction or poverty containment initiative, can provide either grant funding or concessional loans or whatever, these things are possible. But again, the governments have been very careful in their discussions with the multilateral agencies to emphasize that we have done really well as an OECS grouping in bringing the debt ratio down. I think we were, before COVID, we were at about 67%.
As a collective.
As a collective. And the idea was to keep going, bringing it down, because remember, that is also tied to maintaining the sanctity of the EC dollar, so that there are certain provisions there that prevent, unlike other governments with national central banks who in a crisis like this would simply print more money.
Yes, yes.
We can't do that in the OECS.
The US,
we can't do that in the OECS. And I think it's a tribute to the founders of the original founders of the OECS and the persons who set up the central bank, that we have such stringent measures in place that contain the fiscal picture.
Okay. We are fast at the end of our hour, Dr. Jules, and I'm going to give you the time for you to be able to, perhaps if you need to run through some of the other elements, to highlight some of those.
There are a lot of things, and I keep talking about the opportunities, because you see, while we have to respond to the urgencies of the moment and address the priorities, we also have simultaneously to be thinking of the strategic opportunities. How do we use this to transform things to get where we've been talking about getting, but we've never actually had the fire behind us to make it happen, right?
And the peculiar thing is that we do not need to get there later, but we need to get there now.
Yes, we need to get there now. And then all kinds of possibilities. So you look at a confluence, for example, of COVID and its impact in the diaspora, which has been very severe. More St. Lucians have died in Brooklyn and New York than have happened in St. Lucia.
St. Lucia, yes.
Right? And that goes for every member state of the OECS. But on top of that, you've had the recent political unrest surrounding the whole Black Lives Matter thing and the police brutality in the US. Now, what does that create in terms of opportunity? I think a lot of the diaspora citizens will be looking to head back home. We see that happening in Jamaica for sure. A lot of Jamaicans are going back to Jamaica to resettle. And that provides us with new opportunities. So part of our discussions now is what sorts of policies do we propose to our governments to ensure that diasporans returning home are given special concessions and perhaps an investment regime that is more favorable than that given to foreign international investors, so that they can invest their monies back at home. Now, with the whole racial tension in the US as well, and the deep sense of insecurity among blacks in the US, does that provide us with an opportunity when we thought that perhaps the lifespan of the CIP programs may be coming to an end? And in fact, the governor of the central bank and myself had been asked by the authority to spearhead a review of the CIPs with a view to a better regional thing to prevent the race to the bottom, and how can we, restore the greater integrity and profitability to the program.
To the CIPs.
And in fact, this moment provides us with that opportunity, because there are a lot of Black Americans, wealthy Black Americans, who may probably want to look at relocating to the Caribbean or having citizenship in the Caribbean, bring their wealth for investment purposes into the region, be part of a Black family that is respectful of who you are. And these are the types of, I think there are so many opportunities lurking behind every dark cloud and corner of this COVID crisis that we need to identify and methodically and rapidly. Agility is the key word in this. Agilely pursue these opportunities.
And for the OECS Commission, as you chart this course, you've seen what's happening, guiding the government, what remains the primary focus for the Commission?
You mean, I don't quite get the question, because our primary focus is on government.
The primary focus as you are helping the government through this COVID crisis. What is that singular primary focus of the Commission in getting the job done?
To do the job effectively with agility and at the least cost to our government. And that's why a lot of the efforts we've made, you've seen, if you follow our website, you'll see we've had such a heavy emphasis on mobilizing resources by donor contributions or by engaging the private sector. I think we have to find ways of doing things. I always tell people, the problem is not money, it's imagination. If we really want to achieve something, there are ways of doing things. I mean, just yesterday, for example, I got a letter from the Tourism and Hotel Association in St. Lucia listing about 6 areas that they would like assistance for. And our colleagues at the Commission were like worried, well, these are really necessary areas of assistance, but we don't have the money to do it. And we're like, no, there are ways we can do it. And we started brainstorming on what are the things we can do without money to provide the assistance that is required. So for example, one of the things they're asking for is for, they need a lot more data and research done on things, right? Now, we don't have a research department at the OECS. Neither in these times will I go set up a research department when I'm not even sure what our subventions are going to be like in the coming months. So, but in St. Lucia, you have a network of young professionals, persons like Janai Leos, who have been doing extraordinary research, just as enthusiastic economic professionals. And we've spoken to them about the idea of forming a network of a research network, extending that, not just it being a St. Lucia network, but reach out to colleagues in the rest of the OECS. We will provide the platforms to enable that and have an OECS-wide network. Now think of the impact of that on the public service, where young professionals are enthusiastic about research. They're being facilitated in the conduct of the research, where we can mobilize resources, finances, and so on to facilitate the research. We do that. We've spoken to, there's an association of Caribbean professionals at the multilaterals, World Bank, IMF, and so on. Zinga Venner, the daughter of Sir Dwight, is the president of that association. We've reached out to them. They are prepared to do peer reviews of the research done by these young professionals. They are prepared to help with internships and placements at the World Bank, research opportunities. We, from our end, from a diplomatic angle, can look at opportunities for research fellowships, for scholarships that are focused on research in areas where we critically need to do our own research. Because, and this is not academic, because COVID has shown, and we are entering into a world where data is key. All decisions going forward have to be data-driven. We cannot be vooping or guessing. We have to operate on the basis of scientific data. And if we don't generate our own scientific data, we remain at the mercy of those people who will prescribe to us what our solutions must be.
All right. I want to thank you very much there, Dr. Didicus Jules, the Director General of the OECS, giving us some very sort of wide, broad-based look at what's happening with the Commission and the work that it has been doing with the government of the OECS in the response to COVID-19. Want to tell you that stay with us, because coming up at the top of the hour, we'll be continuing to look at the roadmap to recovery, and we'll be having a panel discussion of the disaster risk financing strategy for St. Lucia. You don't want to miss that discussion. I'm Melissa Joseph signing out from the Information Command Center. See you next time.